Hello and Assalamu alaikum. Ultrascan Diagnostics. Here is the CBCT of the patient which you had requested. This is not a full head and neck CT scan. Upon the patient's request, we did a CBCT with a field of view which is encompassing the ramus as well as the body of the mandible. Now, on the pseudo panoramic view, you can very clearly see as you can very clearly see on the pseudo-panoramic view that we've got multilocular radiolucencies in the ramus, as along with a highly radio-opaque material within the body of the mandible, starting from the lower left premolar to all the way to the lower left second molar region. Now we're going to take you to the transaxial view, which is the true cross-sectional view. We've got an impacted canine. You can see the impacted canine right here. We're going to zoom in for the crying doctor. There you go. And then as we move distally along the ramus, you'll see the radiolucency. Radiolucency starting to appear. You can see that we've got loss of mandibular architecture from the buccal cortical plate as well as the lingual cortical plate. As we move distally, you start to see the radio-opaque nature of the BIP dressing that has been placed within the lesion. But you can see the radiolucency encompassing the inferior part of the mandible and the body of the mandible, where the buccal plate as well as the lingual plate and the major cancellous area of the mandible is now radiolucent and lost to the lesion. Now the big paste is also encompassing this entire lesion, and we can see that it is very closely associated with the roots of the molars and the premolars all the way back to the second molar, which you can see very clearly here. And you can see as we move distally, the architecture of the mandible buccal plate and the lingual plate starts to develop. The inferior alveolar nerve has been pushed inferiorly due to the growing lesion. This is a multilocular radiolucency. You can also see that as we move towards the ramus, the multilocular radiolucency develops here also. It has three particular distinct lesions here in this part, and then at the posterior part of the mandible can also be seen. We'll take you to the coronal sections, which will give you an idea of the radiolucency and compare it to the mandible. So this is on the right hand side. This is the coronal view. You can see the multilocular radiolucency on the posterior part of the ramus, and as we move towards the anterior part, you can also see very clearly how elaborate the lesion is. This is the axial view or the top to bottom view. Here also you will be able to notice around the left hand side, you've got a severe area of radiolucency which is multilocular in nature. So this is all the way from the condyle. You can see the two condyles, and from here you can see the region growing. It's expandile. That means we have expansion of the bone in the ramus, and we have this area, and as you move inferiorly you can see the lesion has also called increase in the size of the mandible. On the lower left hand side you can see that there is expansion of the bone and there is swelling inside the bone as well as the multilocular radiolucency. Thank you very much.